welcome to the George Washington University School of Business Leading in a Healthcare Crisis Conference. My name is Linda Acholonu, and I am a Senior Project Manager at Covance. And Covance is the drug development division of LabCorp Inc. I'll just tell you a little bit about me. I'm a Senior Project Manager, as I said, and I'm also a 2020 recipient of the Eric K. Winslow Award from the School of Business. I recently graduated in May, but I think everyone forgot that I graduated. And now I'll hand it over to my colleague, Dr. Alyssa Avo.
Thanks, Linda. Good morning, everybody, assuming that you're on the East Coast. It is a pleasure to be with you, Linda. My name is Avo, and I'm a pediatric in the emergency. I'm honored to represent GW School of Business as this year's nominee for the Business Leaders of Tomorrow 20 online MBA report. Linda?
Thanks, Alyssa. So before we start, let me just lay the ground rules. Each of the keynote speakers will have 12 minutes in a panel format. If you have any questions, please ask your questions in the chat box. Alyssa will be collating all these questions throughout the sessions, and we'll ask the presenters at the end of the session. Okay. And then we'll have a little bit of a transition around 9:55 to allow folks to get off this session and log into their respective sections. All right, so I'd like to introduce our esteemed conference chair, Dr. Ayman L. Tarabishy, Deputy Chair, Department of Management, and Dean Liesl Riddle, Associate Dean, Graduate Chair of Programs.
Thank you, Linda. Greetings, everyone, and I'm glad you are all here. I hope you are all safe and your family is safe here. And I am just delighted to have you here. And my name is Ayman Tarabishy. I'm the Deputy Chair of the Department of Management at the GW School of Business, and I'm also the conference chair. But before I talk about everything here, I want to do some thank yous here. And let me start first of all by thanking my spring class, the Foundations in Healthcare Management class, for putting together the foundations of this course that my students now are taking, my MBA colleagues are taking here, for setting up this course for us. So it was working with them in the spring in the midst of the COVID crisis that we started to put down laying the foundation for this course, which is one of the outputs or one of the deliverables is this virtual global conference here. So this is just amazing to see at the first time ever that one course is setting up another course for their colleagues. This is just absolutely great. I want to also personally thank and give full credit for Dean Riddle, and she'll go next here, for coming up with the idea of putting a course together in the midst of summer. And it's exactly what the title you see here, Leading in a Healthcare Crisis. So that was her title. That was the message I've received. And we worked closely together to get this course on the books. And we asked our students if they wanted to join, and we had almost 30 students join. And I don't know what they were getting into here, but they realized in the first class that one of the outputs was putting together, and I think it's the first ever online virtual conference and the GW School of Business puts together and on a topic so important for today, which is leading in a healthcare crisis here. So I want to thank Dean Riddle, I want to thank the School of Business, and I want to thank the previous class and my current class for putting this together. This is just amazing here. And I want to also thank everybody that was working with me on the course itself and putting together all the different sessions, the team leaders of every session. You'll meet them today. They're absolutely fantastic. They were talking to speakers. They were recruiting the speakers. They were putting the agenda together. They were putting the presentations together. This is just amazing. I am just, I'm just amazed at the amount of work they have done. I have some data to share with everybody here, just to show you the reach of the School of Business and International Council for Small Business that partner with this. Based on the registrations that we have, that people have registered this, we have 33 unique countries that have registered for this conference. We have over 16 hospitals represented that are aware of this conference, are either watching us via Facebook or Twitter or actually joining us in Zoom. And we have 21 universities that our faculty and other colleagues of ours from other universities have joined in for this. So this is absolutely unique for us. This is what we mean for School of Business. We say we're in the middle of everything here, not only just location here, but also online, right? And I think this graphic represents us really beautifully here, that we can bring everybody together. And that's, I think, a critical role of a School of Business as we move forward. I want to thank a couple of people personally here. I want to thank, of course, Sky, Tammy, Kyle, you better get an A on the quiz, and for all their hard work for putting this together. And I want to personally thank Linda, and I know your parents probably are online here. You're absolutely fantastic. I know you've graduated, but I think I've sent you enough messages that we have delayed your diploma in the mail till you work for us. And I don't think it's going to come for a long, long time here. So you're going to always be with us here. And Alyssa, greetings to your mom and dad. She's absolutely fantastic. She is in Korea, and so she's working a different time zone here, but she's always been responsive. I doubt she ever sleeps, but that's something that we just have to work with here. So I want to thank them both for helping us with this. So with that, I want to thank again everybody. I look forward to a great session today. I want to hand it now to my colleague, Dean Riddle.
Well, thank you, Ayman. It is so wonderful to see so many parts of the GW School of Business community participating today. You know, it just makes me so proud because it's really, what's really needed right now is community, right? Community innovation. And I think really George Washington School of Business Healthcare MBA program has been for such a long time really at the cutting edge of thinking through the business and execution of healthcare and how to push those boundaries forward. And if there's anything that the world needs right now, is that kind of innovative thinking and development and leadership. You're going to hear today from many actually of our graduates from this program and students that are in the program, all of whom are working from different sectors of the healthcare industry to push those boundaries forward, to manage this crisis, and most importantly, to solve this very important crisis facing the world right now in healthcare. GW actually started its healthcare MBA program in 2004, all online. And that's really very amazing. It truly was one of the very first healthcare MBA programs, but also MBA programs in general that is online, that was truly global in nature. And I think this conference very much reflects this history and this tradition of bringing thought leadership from around the sector together in community to solve problems. I just really am so excited to see some of my former students, my colleagues, as well as our organizational partners coming together in this conference to really discuss how to lead in a healthcare crisis, and most importantly, to put a toolkit together for leading in uncertain times. Thank you very much, Ayman, for all that you've done. Your leadership truly is exemplary and is exactly reflective of the GWSB community spirit. Thank you all very much, and I look forward to interacting with you through the conference today.
Thank you, Dr. Riddle, and thank you, Dr. Tarabishy, for those wonderful words. We have three fantastic speakers in store for you today: Dr. Rahul Shah, Ms. Alena Hammond, and Mr. Bill Oldham. These individuals are industry veterans with a lot of experience that we can all learn from. So I'll give it back to you, Alyssa.
Thanks, Linda. It is a pleasure for me to introduce our first speaker. Dr. Rahul Shah serves as a Vice President and Chief Quality and Safety Officer at Children's National Hospital. In addition, Dr. Shah is a Professor of Otolaryngology and Pediatrics at the GW School of Medicine and Health Sciences. I would also like to highlight that Dr. Shah is a GW alum, having received his MBA from the GW School of Business. Dr. Shah is a recognized leader in patient safety and quality, and he played an instrumental role the Children's Hospital's response to COVID-19. It is truly an honor for me to introduce to my mentor and colleague. Dr. Shah, please take it away.
Thanks so much, Alyssa, and thank you all. You stole some of my introduction there because it was going to start with gratitude. Dean Riddle, Professor Tarabishy, thank you so much. I graduated from your program in 2014. It's been absolutely phenomenal, changed the trajectory of my professional career, and I think my wife would say personal life as well. So thank you all very much. Professor Tarabishy is the real deal. Love his class. I wish I could take it every year. Still have the books and the coursework. So thank you, Professor, for pushing innovation. And this is just another example of how GW continues to lead the way with innovation. So thank you, Dr. Tarabishy. So Children's National is located a little bit down the road from George Washington University School of Business. And Children's National has been around for 150 years. And that really means something when you think about it. The hospital's been serving the community for 150 years. And when we talk about crisis and pandemics, we often go back to that. For us at Children's National, we're in day 130 of COVID, starting from March 15th, when we had our index patient and index employee both within 6 hours. We count those days, but as our chief medical officer reminds us, we've been around for 150 years, and our job as leadership is to ensure we're there for the next 150. So we've become a thought leader during the pandemic, and it's very exciting how our chief executive officer, our leader of infectious disease, has helped shape outcomes for children across the country and world. It's been very fulfilling. I'm going to go through some personal stories, and I'm going to watch the time to be respectful to my co-presenters. I have a quote, and then I'm going to share stories during these last 130 days that have really brought it home. Connect, then lead. I learned this the hard way. And many of you know, I have two of my colleagues here, Dr. Avo and Dr. Collier. I learned things the hard way. I'm a surgeon. I'm an ear, nose, and throat surgeon. We'll talk about that in a little bit. I was reminded of this quote in June. In June, I was speaking with Matt Kohut, who does some work at Children's National and helps us think about leadership and communication. And he said, well, how's it going? I said, oh, it's great, Matt. I'm doing perfect. It's just all the other people. And Alyssa, you could imagine me saying that. And then he said, well, let's pull back a little bit. What frustrates you? What are you unable to execute? And I went directly into operational details. And he said, you know, Rahul, I want you to read this article I wrote in 2013. It's called Connect, Then Lead. And that was the second time during the pandemic where it dawned upon me that to really lead the team, you need to take a moment and connect. And it was all around me, but sometimes when you're running the operations, you yourself forget to make those connections. Once my eyes were opened 10 weeks into COVID, it really hit the light. And I don't know if I changed 180 degrees or not, but there's a reason I'm starting this great webinar series or lecture today with Connect, Then Lead. You all are leaders. But first, we must remember who we are as humans to connect. Our chief executive officer started a town hall cadence. 3 times a week, he would lead a town hall. And he would talk about himself first. We got to know that he has a cat that's 16 years old, that he had a virtual graduation for his senior from Washington University, and various other bits. Look what I'm remembering. I'm not remembering the tactics, I'm remembering the connections. And this article by Matt Kohut really drove it home. Our chief executive officer, when we started working on COVID, he said something that was very simple yet profound. We've got to protect our employees. If we don't keep our employees safe, there's no way that we're going to be able to care for our kids. Indeed, he was teaching us to connect, then lead. If we could go to the next slide, I'd appreciate that. So often wrong, never in doubt. We don't know where this quote came from, but it's been passed down as surgical lore. If you've ever been in my household, I'm wrong all day long, but I say definitively, and I make a decision. During the COVID pandemic, it's all about making decisions. I was a little bit late to join the pre-call this morning because I was with our chief medical officer. I report directly to our chief medical officer. And we spent 30 minutes talking about the need to be decisive. Wasn't scolding me, but we were looking at examples. And it's amazing what he said. I wish I just would have recorded him. He said, in times of crisis, there's a leadership void or vacuum, and people need decisions. And I make wrong ones all the time. I look back on June 26th. On June 26th was a Friday, and we rolled out a protocol for aerosol generating procedures, where the CDC a few days before said, whenever you're doing these procedures on patients, you want to protect your staff with a certain kind of mask. I thought that sounded good, and I told people to operationalize it. But boy, did I botch up that rollout. Probably should have brought the leaders into the auditorium, done a Zoom call. In hindsight, learned some lessons, but still would have made the same decision. We've made a lot of wrong decisions over the last 130 days, but we gamble on the fact that we've made more right than wrong. We rolled out testing algorithms. People needed to see algorithms on how to care for patients. We rolled those out. Certainly we needed to scale them back and fix them. We rolled out temperature screening. It worked for 2 weeks, but we had to change them. As leaders, especially in healthcare, don't perseverate. Make those decisions. They might be wrong, but make them, and don't be doubtful. Next slide. About 9 months ago, I was walking by one of the executive assistants, and she looked at me and she said, boy, you know, Dr. Shah, sometimes you just seem to have it together. And by an epiphany, this quote came to me. And I said, Miss Sarah, this just doesn't happen by accident. And I've really made that a little bit of my mantra for the last 9 months, especially during COVID. And let's go into some specific examples. Our chairman of our board is Jeffrey Zients, founded the advisory board, was a key Obama advisor for ONC, a rollout. So Jeff Zients and our CEO had a vision, and they said, you know, we should be testing for the community. It was a phenomenal vision, and that vision was within the first week of COVID. We were all trying to understand how we take care of our patients' employees, but these two visionaries lifted up, and we were able to stand up a community testing site supported by philanthropy to help the community, to help the children of DC. And now, 130 days later, we have rich data. Not only have we helped the children of the district, we can do seroprevalence studies. We're able to understand the positivity, but that didn't happen by accident. That was a tactical decision. Another wonderful example is telemedicine. Prior to COVID, we were about 1 to 2% of all of our visits were telemedicine. During COVID, we got to 72% within 3 days. That shit does not happen by accident. That was years of work, but the team was ready to pivot. And we're hearing about that in all these industries, that COVID, and Dr. Tarabishy, I'm sure you'd love this, COVID has forced innovation. But people laid the groundwork, including yourself, Dr. Tarabishy, for many years, helping us think about telemedicine and how we're going to move it along. The recovery planning for COVID. I'm always in awe of our executive leadership. While we were in the midst of COVID, which started for us March 15th, in the midst of it, 3 to 4 weeks, our chief operating officer started a committee called recovery planning. Recovery planning? We're still in the middle of COVID. But that recovery planning has proven to be invaluable in June and July as we turn that corner. And that doesn't happen by accident. It's tactical. One of the most important things I've been doing this crisis is professional development. I'm a big fan of Harvard Business Review. I'm a student of business, and I'm forever grateful for my structured MBA program, but that learning doesn't stop. At least 30 to 45 minutes a day, I'm reading something about business. Maybe I'm going back to the archives of Harvard Business Review. Many of you know they published a wonderful compendium that came out this spring, classic management articles. I can't get enough of those. Why am I spending 30 to 45 minutes of my day, of my 24 hours on continuous learning? Because it helps me, maybe not that moment, but a week or two down the road. So I beg you to keep learning, especially during a crisis. It's more important than ever. We go to the next slide. I have 2 more pearls. I am shocked by how many people watch us as leaders. Do not underestimate it. We started our town halls, and I did something that I will be forever grateful or perhaps forever regretful for. Nobody picked up the computer to monitor the chat. So our CEO was leading a town hall with 1,700 folks. And I said, sir, let me man the chat. So the chat started exploding, and the CEO looked at me and said, Dr. Shah, there are questions. Yes, sir, there are questions. Would you like me to read them? So now, during those town halls, about 60 of them, I read questions for the CEO. But what's shocking is people pick up on my voice, my intonation, my tentativeness. My friends will text me and say, well, you didn't have a questions today. Is everything okay? Oh, I hear your voice is cracking. Did you avoid some questions? Even to what I wear. For those of you that know me well, I wear a white shirt. I have 20 of them. Some of them are different than others. They might have patterns, they might have stripes, but they're all white. Last week, I did an experiment. I wore my blue shirts every day last week. Every step of the way, people stopped me. It was absolutely shocking. Just don't forget, everybody is watching, from the patients to the staff. And what they need is consistency. We have a highly educated workforce. We have people with quadruple degrees, way smarter than us, but they are always watching and looking at us. I'd like to end with something I've learned in these last 130 days, and that's this story. I'm going to read this story, and I want to drive it home. There's a Taoist story of an old farmer who had worked his crops for many years. One day, his horse ran away. Upon hearing the news, his neighbors came to visit. Such bad luck, they said sympathetically. Maybe, the farmer replied. The next morning, the horse returned, bringing with it 3 other wild horses. How wonderful, the neighbors exclaimed. Maybe, replied the old man. The following day, his son tried to ride one of the untamed horses, was thrown and broke his leg. The neighbors again came to offer their sympathy on his misfortune. Maybe, answered the farmer. The day after, military officials came to the village to draft young men into the army. Seeing that the son's leg was broken, they passed him by. The neighbors congratulated the farmer on how well things had turned out. Maybe, said the farmer. This really opened up what it's been for us since March 15th. Almost every day is a maybe. It's actually changed the way I interact, not only with other folks, but at my home as well. So March 15th, we were part of the first wave of COVID at Children's National. Some would say we were lucky. Maybe. They said kids weren't affected as much as adults. Maybe. Then we identified a syndrome here at Children's National and other places across the world, multi-inflammatory syndrome in children. Oh, well, that's really bad for kids. Now we know what they get. Maybe. Now we don't know if children are carriers or not. Maybe. My point is, you can build that into how you lead. And if you lead with an open mind and understanding that luck isn't here or there, but what you do with it as a leader, I think you'll be prepared for a crisis. Thank you for giving me the platform, and with gratitude, I pass it back to you all. Thank you.
Thank you so much, Dr. Shah, for sharing your insights with us. That was really good. And now I'll go to our second speaker and my mentor, Ms. Alena Hammond. Ms. Hammond is a Senior VP, Head of Clinical Development at Covance, and that is the Drug Development Division of LabCorp Inc. Ms. Hammond is responsible for operational delivery for full service outsourced phase 1B through 4 clinical trials. The portfolio is comprised of over 500 active trials across the top 40 pharma and emerging biotechs in a variety of therapeutic areas. In this role, she leads a global team of over 1,000 people. And now I'll turn it over to Ms. Hammond.
Thank you, Linda. It's such a pleasure to be with all of you today. You can go ahead and advance to the next slide. Thank you for that. So I just wanted to spend just a moment just giving you a bit of a background of the organization that I work for. So first of all, my connection with George Washington, I would love to say it was as inspirational as Dr. Shah, but it is inspirational because Linda reached out to me last year and said, I'd love for you to mentor me. I'm in the business school. I'm looking to graduate next year, and I'm looking for someone to lead me through my career development. And it's always an honor for my employees to reach out to me and say, hey, I like what you're doing. And as you said, Dr. Shah, watching and listening and wanting to learn and develop. And it's been a pleasure. And it's great for me to see that Linda has now graduated, but still heavily involved in her school. It's just wonderful. So I do work for LabCorp, which is a diagnostic division. Many of you probably recognize the name. It's been pretty prominent in the pandemic for COVID-19 for its expanding testing capabilities and now at-home testing kits. But however, I work for the Covance side, which is the side of the division of the organization, as Linda said, that actually supports our biopharmaceutical and biotech companies for the conduct of their global clinical trials. So as you can imagine, leading an operations team, conducting multiple clinical trials for multiple customers has been pretty stressful, in the fact that it's impacted our traditional ways of how we monitor the conduct of our clinical trials and the safety of our patients. So what we've had to do, many of the things that Dr. Shah referenced in how to plan, how to risk mitigate, how to understand multifaceted risk, and then how to not only plan for how we respond immediately, but then what do we do on the back end from a recovery perspective? So that's what I'm going to focus on for you today, is just to share with you what we did as an organization to mitigate and plan, and still continuing to plan on that recovery for our in-flight clinical trials. Next slide, please, Linda. So first of all, we entered into, we have some standard SOPs and policy, again, it's in place for how we respond to business continuity planning. And when the COVID-19 first started in China, and that would have been at the end of January, we immediately enacted our business continuity plan, but of course it was very localized at the time. But we were always thinking with the end in mind that this could be a pandemic, this could spread. So as we set up our processes for how we want to respond, let's be thinking about that on a local scale as well as a global scale. So it started in China, that as the virus spread across the globe, we eventually enacted our business continuity planning across all of our active clinical trials. Our plan was centered around many key areas. However, I just want to focus on a few with you today, just to kind of demonstrate to you our thought processes as we were thinking about how do we protect the well-being of our employees, our customers, and our patients who are participants in our clinical trials around the globe, which has its inherent risk anyway, as we know, on that drug development continuum. But then how do we make sure that we still continue to think about what those risk mitigations are and how we protect our vital employees and customers and patients against that. So first and foremost, we talked about how do we protect our employees? What do we do? And it was many of you that may understand the traditional processes of clinical trial. It involves a lot of travel. It involves a lot of travel to our investigative sites and working with the physicians and study nurses who are conducting the clinical trials on the ground in the countries. And we send out clinical research associates to those sites to work with them, training, overseeing, making sure that the conduct of the trial is meeting good clinical practices. But in a pandemic with travel restrictions, that is no longer possible. So what do we do? First of all, how do we protect our employees who are on the field? And as well as think about the protective equipment that they would need, and how do we start to work differently? How can we work from home, and what kind of capabilities would we need to do that? And then also for employees that are still required to go into the facilities to conduct testing or other things like that, how do we protect them? So that was a major part of our initial planning. The next one was our risk assessments around just understanding the risks for our clinical trials that are in flight. It was complex, it's multifaceted. We had to think about it at a project level. What is the risk to our patient safety, to the data that we're trying to collect through the conduct of that clinical trial, and to our overall project continuity? We have timelines that we're trying to meet. There are deliverables and milestones. There are interim ways that we're checking the data. So how do we continue to gather that data and make sure that the data is viable? Then there was local country regulations that we needed to consider. Every country was responding differently. They each were sending out their own set of guidelines. We needed to make sure that we could adapt to that locally as well as globally. And then our overall business, as a business, how do we plan for the portfolio of work, including our ability to protect jobs and our employee welfare? A next big area for our planning purposes was how we're communicating with our customers. It was important that we inform them about our plans and our efforts to assess and mitigate the risk to the participating patients, as well as their data integrity, to the clinical trials that we were running on their behalf. And then lastly, our investigator site communications. We know many of our investigative sites are within hospital settings, and they're being challenged with many other challenges in front of them about patient safety and care and how they are reacting. But how can we help them as we're partnering with them to help safeguard patient safety, to come up with innovative solutions for how they can continue to see patients in very standardized and regulated ways, because that's what we have to do when we're conducting clinical trials, as well as just thinking about ways that we can continue to safeguard patient safety. Just think about what are ways that we could, if a patient could not get to the clinic, how could we continue to get their investigator's product to them or collect safety assessments? So those are all part of the innovations that we had to be very ready to deploy and think about. If you, on the next slide, Linda, as you can imagine, patient safety is paramount during the conduct of a clinical trial. And it's been heightened during this COVID-19 pandemic with the uncertainty of the ability of patients to return to clinics for their own follow-up visits and plan and safety assessments. We've engaged with each site and for each clinical trial to assess the risk, build individualized continuity plans, and we've continued to track ongoing risk as we've seen pockets of resurgence. It's a very interesting time that we're in right now because we're getting variability for sites that may be open and ready for business one day, and then the next they're not again because there's been a pocket of resurgence. So how do we thinking about the consistency and standardization of a clinical trial, plan for those, get in front of those, have contingency plans? And so as we've identified individual sites per protocol risk, because each site will have certain risk according to the protocol that we're conducting, we've actively worked with our customers as well as other services to provide innovative responses and solutions to each unique need. And Linda, she mentioned at the beginning, she's one of our project managers. So she's been at the heart of this day in and day out in regards to that risk planning for the clinical trials that she's overseeing and running. So our last slide that I have today for you is to really talk about our road to recovery. And again, thinking ahead, and I have a very similar experience as Dr. Shah. I was leading our response efforts globally for COVID-19, and my leader about probably 8 weeks in said, "What's our recovery plan?" And I had a very similar reaction where I was like, recovery? I'm still just trying to figure out how we respond. I've got over 500 clinical trials that I'm worried about and all these local country needs. What am I thinking about recovery? But we did a same, it was fascinating to me because we did the exact same thing. We got a separate team together, committee, to start thinking about recovery and putting recovery plans in place. And we have them in place now. They're multifaceted, having to think about lots of different solutions, but we've had the ability to also use that platform to launch how we innovate for the future, knowing that our industry is changing. It will never be the same again. So how do we use this to just drive that innovation and help our customers think that way, as well as get information from the investigative sites that we're working with to help understand what their needs of the future will be. So we have this, we've provided this comprehensive plan to recovery. It's a very busy slide. I wouldn't ask you to read all of it, but it's just wanted you to see the complexities that we're working through as we're thinking about how we continue to protect and support our patients, minimize the loss of data that power the clinical trials. I mean, it's a big problem if we're not able to collect the data, because then we won't be able to understand the problem that we're trying to solve as we conduct this clinical trial and get the information that we need to say whether or not this drug, this compound or device should continue on its development cycle. So we've had a very multifaceted approach considering all aspects of clinical research. And I'm just going to walk very briefly through some of these with you. So first of all, it's about working with our sites to understand their constraints and how can we prioritize the work that needs to be completed. If you think about it, if the sites are being pulled into many different directions, the traditional work might be piling up. The amount of work that needs to be reviewed, data to be entered, queries to be resolved might be getting backlogged. It's what we're seeing. Sites are not, and some sites are not even able to, employees are not able to go on site. So they're not able to get to the patient records to be able to answer some of those questions. So how do we prioritize what they do look at when they return to the site and we start to see re-engaging and opening back up of our traditional working environment? So we really talk about critical data collection. What is the critical data? What do we need to focus on first? What is our priority to be able to safeguard our patients and ensure that the data that we're collecting will answer the questions around our clinical trials? Resource planning. I lead a service industry. And in a service industry, it's about the people that you have on the ground doing the work. But the work volume is changing. So how do we ebb and flow with it? How do we know what that resource planning needs to look like in times of uncertainty, especially when our traveling and normal ways of working has changed? At the end of the day, we have to be inspection ready. Our healthcare regulations across the world, the FDA, the MHRA, they're going to come and inspect us. They're going to ask us what we did during this pandemic to safeguard our protocols, to drive consistency, to protect patients. And we need to be able to demonstrate and storyboard and show them what we did to make sure that we did everything we could to follow ICH and GCP requirements. We need to be able to understand and align with many, many global regulatory guidelines. As I said, every country has produced a variety of their own interpretation of what the guidelines should be right now. And that's very difficult when you're running a global trial. So how do we look through those, pick out what's important, educate our organization, and ensure it folds into our inspection readiness planning? We need to continue to drive innovation to support our customers, our patients, and our employee needs to meet the evolving needs of the industry, and asking questions about how can we reduce patient and employee exposure while we travel when it opens back up, but still collecting vital data and active information required for drug development. And lastly, but certainly not least, we need to continue to focus on employee health. As the sites do start to resume activities and allow clinical research associates to return to their facilities to monitor the data, how do we best protect our employees as well as the site employees? So in summary, it is vital that we always consider the needs of our customers in delivery, patients and our employees in a global and local way. And as we consider these aspects, we must also remember that, as I said, I'm operating a service-oriented organization, and people's lives and the environments have been impacted, and we will continue to be impacted. So as we evolve and manage risks, we need to be empathetic to the needs of our people. Thank you very much, Linda. I appreciate the opportunity to speak to you today about our practices that we've put in place.
Thank you so much, Ms. Hammond. I appreciate you giving us your unique perspective on this, especially when clinical trials are in the forefront of COVID-19 right now. Thank you so much. Okay, so we'll round out the session with our last speaker, Mr. Bill Oldham. Mr. Oldham is an entrepreneur, investor, and consultant with over 25 years of experience supporting growth industries and high-value clients across health, technology, finance, and energy. He also leads cutting-edge and dynamic companies in a broad range of industries. We are so delighted to have you to share your perspective on leading in a crisis. Mr. Oldham?
Thank you, Linda. Can everybody hear me okay?
Yes.
There was some audio problems earlier this morning. Well, thank you for the opportunity to join you today. It's been a pleasure to listen to my co-presenters, Dr. Shah and Ms. Hammond. Thank you for your remarks and for your leadership in important organizations in this critical time period. As I was talking with Dr. Sargent, who'd asked me to come speak, I really appreciated the opportunity to share, I think, a couple of different perspectives. We'd go to the next slide. I currently lead 3 different organizations at a board level, and I chair all of these boards, and they each have really very different profiles in the marketplace and very different challenges. Acela Health is a specialty pharmacy management company. That's a company that is basically helping people with critical and often chronic diseases get their prescriptions, take the prescriptions properly, access specialist care, access proper site of care. As you can imagine, when that had to go, even as an essential business, 100% virtual, the challenges of making sure every patient was dealt with properly and was able to get their medication and know what it meant to take it and to be compliant, that's been pretty phenomenal. I have to hand it to my colleagues at Acela. I mean, everyone from across that entire organization has really stepped up to the plate and delivered, I think, with a lot of heart. And I think that's something that stands out from both Ms. Hammond's remarks and Dr. Shah's remarks as well, is that that's we lead from where we are, and we have to really lead from the heart to drive the kind of caring work that's needed in a crisis like this. The foundation, we set up a nonprofit about 10 years ago, focuses on health transformation and economic empowerment issues. So you can imagine a lot of what the second and third order impacts have been of this crisis have hit economic issues as well as health and safety issues. And we're seeing that in clients and our projects and a number of community efforts that we've been working. We've been working on the opioid epidemic with LA County, fascinating challenges in a very highly diverse environment in LA, and one that I think is going to continue to really lead the country in defining ways in which we can address critical problems with heart, with caring, and with bringing everyone together. I also had the opportunity to lead a family office investment firm, probably one of the more challenged environments in terms of watching markets implode and then rebound, and watching people react to the greater trends in the global economy, and what are those reactions going to do, and how do we deal with that, and how do we move forward and change and pivot to strategies that can work in the current environment. Each of these organizations has been impacted differently, has required a different leadership response, but there are also some few similarities. Next slide, please. So the similarities, I think, and forgive me for being unabashedly business focused here for a second, everything we do requires cash. And the cash flow challenges when suddenly the world kind of comes to a halt, and the changing nature of credit cycles drive major challenges in the way people operate. Investment slows down. People sit on cash. They don't know what's going to happen 2, 3, 4 months down the road. To Dr. Shah's point, I've been spending a lot of time in webinars myself and trying to continue to learn and focus, and gone back to some of my MBA courses to hear what people are saying now about how we how we respond in terms of managing the economics of our businesses. If you look at it from this perspective for a minute, in January, if anybody had said to a public sector CFO, you need to hold on to a year's worth of operating cash, those people would have been laughed out of the room. Now, we look at it and say, we don't know what's going to happen with our customers. We don't know what global supply chain disruptions are going to do. And we don't know necessarily what that's going to mean for the cash hoards that we're sitting on. We thought we were prepared. Maybe we're not. Debt ratios of being able to leverage a business to go and invest and do different things means something very different today than they did, 3, 4, 5, 6 months ago. So at a very practical level, the old adage that cash is king has really resonated, I think, with more and more people as they realize that it's the lifeblood of business. And so we have to make sure that we are prepared, and prepared means something very different today than it did. I think the other similarity that I would say has struck me is we are really all social animals with a deep need to connect. I talk to my operating partners and chief operating officers on a regular basis, and the recurring theme is I get my energy from the interactions I have with people, and when I don't have that, this kind of it's a real difficult social environment. I am endlessly grateful that I've been able to be successful enough to have plenty of space, and you'd be surprised how much space makes a difference, even with just 4 people in a house. And I can't even imagine, trying to, work through what one of my operating partners is doing, and I'm sure many of your colleagues and friends are doing as well, where, you have the kids home, you've got to be a teacher, you've got to be doing your work, you've got to be doing all of the things that you have to do to keep your family going. And that social connection has shifted dramatically in our society. And I think sensitivity to it in leadership is something that we all have to work on every day. We have to meet people where they are in that social construct, not where we wish they were, not where we think they are, but where they are. And that takes me to the next point, is we're all in this together, but working together is a different issue. And I think we have to be sensitive to and understand, what that means in different circumstances. The other point I'd make on this slide is that, and this is just a statement of encouragement as well as recognition. Fear is pervasive. And what fear does in our reactions is sometimes constructive and sometimes not. And I think as leaders, we all have to recognize that we have to take that fear and help people do something with it. And hopefully something that aligns with their needs for belonging in our organizations, their needs for developing further competence, and their needs for connection. And I think that's something that, I have to hand it to my operating partners. They've done a phenomenal job. People have talked about town halls. People have talked about, all the different ways in which we've electronically met. I will tell you, I laughed when people came up with the idea of the virtual happy hours. I thought, wow, what an idea. Best thing we've done. I mean, absolutely phenomenal, the level of connectivity that it's brought into our organizations. And I have to say, being willing to try the stuff that might seem a little crazy often is a way of kind of unleashing some of that fear and turning it in a positive direction. So just a few points on similarities. Next slide. I think just let me wrap up with just pointing out a few things that I think have been critical across all of these entities. It may seem, a little basic for this group, and I know you're all bright and leading organizations. Listening is so much better than almost anything else you can do. Learning where that person, whatever level of the organization they may be at, learning what they're living with. What are their challenges, that they relax with table tennis, or they relax, with, cocktail hour, or they relax, whatever it may be. Learning to listen makes all the difference. The other one that goes with that is this seeing all the people. I think one of the things that has been pointed out as we go through this crisis, and people somewhat tritely, in my view, say we're all in this together. Well, we are, but it really helps if you know what all means. And that's a very different issue, I think, now. All of us is everybody. It's the people that can't work because they were in the service industry. It's the people that aren't getting the tips because they were your server at the restaurant you like to go to. It's the people that are the nurses and the doctors and everything. It's all the people. And I think leadership has all too often been allowed to kind of look over the tops of the trees and not really see down into the forest. And if COVID is teaching us anything, I think it's teaching us that, we really need to see all the people. I think it's also teaching us about channeling the fear into action. That there has to be things that people can do, and people are wanting to do more. They're wanting to get engaged. I think the level of engagement I'm seeing across all of the organizations I deal with is just extraordinary. And that's without the water cooler conversations. It's without all of the informality that we come to, I think, overly rely on in management. That ability for people to lean forward and be engaged is something we have to take and channel the fear that they may have into positive, constructive action. I love what Ms. Hammond was saying about data and pursuing that. And a lot of when you have fearful audiences, it's all too easy to run in the herd towards a decision point. And I would say step back and look for data and avoid those false choices that lead us to a false place. We can wait a little bit. I think the notion that we're a little disconnected and that we have this ability to connect virtually may force us to be a little more thoughtful. And I think that's a good thing. I think being able to stop, ask for some data, figure it out. And I have to tell you, my team at Acela Health has been dealing with probably one of the biggest non big city outbreaks of COVID. And, we're not going to rush to get everybody back in the physical office. We're going to take our time. And we're going to take our time partly because we want data, partly because we want to have something that can truly be operationalized to help people feel safe, and partly because if somebody wants to or needs to, because of their life situation, work from home on an ongoing basis, so be it. We've figured out how to work through this. We've figured out how to probably be more productive than we were. And let's work with this and figure our way to a new model of working, which is healthy and safe for everybody. So with that, I will I'll conclude and hand it back to Linda, and happy to join the panel and taking questions.
Thank you so much, Mr. Oldham. That was a very great presentation. And I really would like to say that for all three speakers, this has been a great take on your unique perspectives, as well as just one thing that came out to me is that we should all be flexible. Things are changing and we have to move with the times, but I think we can all get through this. So with that point, I will just hand it over to Alyssa for questions.